Hey, everybody. Welcome to the Pulse of Healthcare. It's Dr. John McCormick. I'm sitting here with my friend Chad,
Hey, everybody.
and we're getting ready to go. We've been asking for some of our listeners to call in and offer up some questions that we can answer. So today we thought we would just dive into some of those questions that we received, and I'm just going to answer them off the top of my head, and we're ready to rock and roll. So, Chad, what do we got?
So the first one that we have today is, I think, a pretty common one for people when you hear kind of these bigger names in the insurance industry. So this person, Natalie, thanks for submitting the question. Natalie has a Blue Cross Blue Shield plan, and she's asking, I have a Blue Cross Blue Shield plan. What is the difference between having a self-insured plan and what I have now?
All right, so Natalie has what they would classify in the marketplace as a fully insured plan or insured plan, master medical plan through her employer right now. And what I would say is the difference is ownership, right? When you're engaged with a Blue Cross fully insured plan and you pay your premium out every month and you seek care and your employee and all your friends in your company seek care, at the end of the year they come back and say, hey, great job, everybody. Here's your 10% increase or 15% increase because as we know, the price of healthcare continues to go up year on year on year, right? A self-insured plan, this is where you're now partnering with your employer, and it really becomes you've got skin in the game. This is your money, right? So if everybody's doing the right thing, engaging in a healthy lifestyle, being proactive, working with the plan to make sure that we're paying the right price, the fair price, not the over market price. Then what you can do is year to year to year, you can stabilize those cost increases. All right. So from our perspective, we've had companies with us that have been with us since 2015 that have never had a rate increase. So I'm going to repeat that again. Never had a rate increase. So think about that.
Right.
For the last 8 years, their plan has cost the exact same amount. I don't think there's a Blue Cross member or an Aetna or a Cigna member out there that can say, yep, my plan didn't go up again this year.
You couldn't say the same about eggs, right? Like, you can't say the same about anything in the world.
Everything in the market's gone up, but not our plan, and the way we offer it. And the reason that is because we have great partners. We work directly with the employees and the members to educate them so they're engaging in healthcare in a smart way. And so at the end of the day, what we're trying to do is make you a consumer of healthcare the same way you consume every other product in your life, with your eyes wide open, knowing what your risks are, and knowing how to get the best product for the best price. And I think that's what everybody wants.
Yeah, absolutely. So, as a very simplified answer, I think what you're trying to say here is our plan tends to engage the providers directly, or we have these national brands working alongside us. If you're willing to engage the plan correctly, like you do in your life, you go to Kroger or Walmart or whatever, and you see cheaper water or more expensive water, and you realize that the cheaper water is also just water, then you tend to lean in this direction. So now that you're fully invested in your own healthcare, literally financially, then you are able to evaluate those same things. And as long as you utilize the plan correctly, then your premiums may never increase, right?
Yeah, absolutely.
Yeah, that's awesome. We have another one here from Michael. So Michael writes in, Michael has received really high bills before with insurance, haven't we all? And his friend, though, so he's got a friend that, is utilizing healthcare in a very different way, right? His friend is asking for cash prices nearly everywhere he goes. Why is it the case that his friend is receiving better prices than seemingly Michael's receiving? And can he take advantage of it, or how does he take advantage of it while also having healthcare? Maybe he has an employee-sponsored plan, right?
Well, that is a great question, and I'm gonna be real
confuses
candid.
me today. Yeah, I'm confused until today.
I'm gonna be real candid and say because there's a lot of what I would consider in any other profession, in any other deal, if you were to go buy a car off the car lot and they charge me $50,000 and you $40,000, you would say, hey, that's fraud.
Yeah.
right?
Yes.
You know, hold on a minute. How can my insurance pay
Wait.
pay 40,000 for a surgery, but my friend gets the same surgery
Yeah.
and he's paying 5? What's going on? It's the
Yeah.
same
Oh,
doctor.
you don't have car insurance? Okay, then we're gonna charge you 3,000 instead of 15 for this car. What? It wouldn't make sense literally anywhere
It
else.
would make no sense. And the real deal is most people don't question it and they don't know.
Yeah.
So the short answer is, under the No Surprise Act and the transparency laws that are in place right now, providers are supposed to, by law, tell you what the cash rate is. What we find out is the cash rate is significantly cheaper.
It's about 1/10 the price, I found.
Yeah, about 1/10 the price. And that's what we're discovering in our business. It's like, that's crazy. 1/10 the price, yeah. Well, you also have to think. So I'm going to put on I'm a provider, hospital, big box hospital. Why would I do that? Why would it be cheaper? Well, I'm not chasing the bill. I'm not begging the insurance company to pay me. I'm getting my cash up front. So I'm actually saving a lot of administrative money, which is
Right.
one of the reasons the cash price can be cheaper. So here's the good news. The good news is, if you're using an Ovation plan and you understand this, you can actually go in as a member, because it's an sponsored plan, employer-sponsored plan, which means you are effectively providing your own insurance, right?
Right.
You're insuring yourself. So you can go in and say, I want to pay the cash rate, and make that deal. The cool thing is, we'll work with you so you can make that cash rate pay. Saves you money, saves your employer money, and guess what? Premiums don't go up next year. And that's the point.
Yeah.
So we can leverage the power of cash pay through the platforms that we have.
Yeah, and I think you'll often find the case, and I know it's the case with our company, that we have like a reimbursement program. And I don't think any insurance company is going to be upset about receiving what is effectively a much better deal on the same treatment, right?
Yeah,
So
absolutely.
I think it's a good thing, and it's something that can be looked into, utilized, and it's like I said, about 1/10 the price. So $10,000 bill. I mean, I've often found they will offer you $1,000 or $1,500. So just make money disappear. I wish that money could go in my pocket or appear somewhere else. But
Yeah, absolutely.
yeah, here we are. We have a message here from, it looks like, Denise. So Denise asks, I have heard you mention in a previous podcast that you have a patient advocacy program. How is this important to the plan, and what service does this offer to your members?
That's a great question. I mean, our patient advocates are amazing. You know, I'm not saying that just because Chad's sitting in front of me right now.
I try my best.
What makes it such an important element of the plan is, think about, who do you go to when your car's broke? You go to an expert. You go to a car mechanic, right? Patient advocates are medical experts. They know the systems, they know the processes, they know how to engage them. So why wouldn't you use them? The key is, they're there, they're available, and in our case, they're in-house.
Yeah.
You know, we have them here with us. They know our plans inside and out, and they know the systems inside and out. So they're really your concierge, your what I call medical Sherpa, to kind of guide you through the wilderness of the craziness that's out there in the medical world. And the key thing for us is, you can call them up and say, hey, I got a question about this or that, or how can I get this prescription cheaper, or I need an appointment with this specialist, can you help me get it? Or I just got told I needed to get an image. What's the best place I can go pay cash and do that? Because the cash rate, if you go to the hospital, it might cost you $250 or $500, right?
Right.
That same image at an imaging center in your neighborhood might only be $250. So instead of paying the $500 copay, pay the $250 and get the whole thing done. So there's so many things that a patient advocate can bring value, not only to you as a customer, to the plan itself. That's absolutely what you need to do.
And I've heard in my experience, oftentimes I'll reach out to providers and they have their own patient advocacy program, or we know that independent patient advocates exist. Is that why my personal question for me, is that why you've chosen to implement them as a part of your plan? Is that you feel like there's so much value there that it also helps you internally run something that is both cohesive for the member and creates a better member experience, but can also save the plan money, which then keeps premiums the same, right?
Right, keep premiums the same. Yeah, absolutely. I mean, of course, I have a personal story. If you didn't pick up in previous episodes, I am a retired military veteran, so I have TRICARE, which is commercial, and I have had my own struggles. Even though my coverage is supposed to be really comprehensive,
Yeah.
I have gone and gotten surgeries and followed all the rules and drove across town to go to the in-network hospital, and I have still spent personally, for one of my incidents, I spent a year of my month after month trying to solve a billing error that kept reoccurring, and I had to go back and forth and back and forth and back and forth and back and forth, and it took me a year to resolve it. And I thought, this is dumb. I really wished I would have known somebody that was really smart about this when I was going through that, just out of the military, that could have put their arm around me and said, hey, let me be your advocate. I'm going to help you solve this. I know who to call over at that hospital that's going to get this taken care of. Because ultimately that's what it boiled down to. I finally got to talk to the person that could make a decision and fix it. But I had to go through 11 months of people that couldn't fix it. They were just pushing paperwork back and forth.
Awesome. And the last one we have here, this is from Paul in Houston. So Paul asks, it seems as though Paul's plan has a high deductible and coinsurance. He says he's recently had surgery, and he had no clue that his bills would just be so high, right? You go in, you schedule the surgery, and then all of a sudden, suddenly something's in your mailbox. So Paul asks, how does Ovation make their members aware of the pricing? Because clearly he wasn't in this scenario, right?
Yeah. So I'm going to circle right back to our patient advocates and our member services team. One of the things that we do, because we do cash rates, because we do prior authorizations, the way we do them, all of our prices and costs are revealed. So unless you're admitted through the emergency room where everything's an unknown, right?
Right.
And even then we come back and try to get that solved right away. But if you're doing anything that you're scheduling with us, through us, whether that's a specialist visit or a lab or an imaging or even a surgery, major or minor, we're going to know the cost of that in advance. So we'll be able to reveal to you exactly what your copay might be. So depending on where you're going, and we'll even give you recommendations. Look, if you go to the hospital, that's a 2-day admit, that's going to cost you $1,000. But if you use the surgery center right down the road, it's $250. Or, we might waive it altogether just because of the savings that we're able to incur by getting you to engage in care at a different facility.
Well, and I think that's something that I've noticed is very unique amongst the staff comparative to what I've seen from other insurance companies. A lot of insurance companies are very strict. I mean, this is what's written. This is by the book. This is what we're going to do. And you are willing to bend those rules in favor of the member as long as it's also in favor of cost savings for the plan. And that's a level of hands-onness, because what that means is that you have people scheduling the appointments, getting pre-service agreements or securing those agreements, making sure that everything is set for the member. That's not often the case, from what I've seen from a lot of other insurance companies.
So what you're saying is, Chad, that we treat people like human beings? And
it's
we
crazy,
actually,
right?
Yeah.
You're not just a car.
Yeah. It's funny because obviously I have a lot of people that I know that are in other plans, and they, you would be surprised how many of them come up to me and hand me their bill and go like, can you help me with this?
Yeah, what does this mean?
Because I don't know why I'm paying this. I followed all the rules, and I have to look at it and go, oh, well, you followed all the rules, but you see this anesthesia? That's not in anybody's plan.
No.
You see this physician that came in and saw you? He's out of network. Even though he saw you in your network hospital, that doctor is out of network.
Right. Different tax ID or MPI or whatever.
Right.
Yeah.
So I give them the tools they need to go back and and push back to their carrier and say, I don't owe this. because you didn't properly bundle the invoice, or you didn't properly scrutinize the claim to make sure that, I actually received those cares. I mean, some of them, they'll come in and go like, it says here that I got 6 liters of saline, and they didn't do that at all. And you're like, yeah, you need to push back on that. So itemized billing and those kind of things, that's the difference when you've been being a number in one of these major insurers and actually being a human in Innovation Health.
Absolutely. Well, that's all the questions we have for today. That was phenomenal. I thank you all for submitting questions. If you ever need to submit more, we have the communications at Innovations HR. So that is communications with an S at INNOVATIONS as in Sam, HR.com.
Absolutely. And we'd be happy to read your questions, and I'd be happy to answer them.
Absolutely. That's perfect, Dr. John.
All
Thank
right.
you for having me on again.
Thanks again. Take care. Bye.